Why don't I need a pap smear every year? My name is Dr. Syal, and I'm a practicing OBGYN for the past 20 years, and I am on a mission to create a community where women talk about these health issues, the questions that I get every single day, and to keep these conversations going. Why don't I need a pap smear every year? That is a question I think I probably get every single day, and it's a great, great question. In the past, we used to do pap smears every single year, but in the last 20 years, we have learned two things that have kind of changed the course of how and why we do pap smears. The first thing is we now understand cervical cancer and how cervical cancer develops. We understand that cervical cancer is very, very slow growing. It's not like it's negative today and you get cancer tomorrow. It takes years for cervical cancer to develop, and it's usually precancerous cells that then turn into cancer. Once again, you don't wake up and all of a sudden there's cancer. It's a process: precancer, precancer, and then cancer. The second thing, we now understand why it happens, and that is because of HPV, human papillomavirus. And that is a virus that causes abnormal cells on the cervix. It can cause also abnormal cells in the throat and in the anal area. We have gotten so good at it that we now have a vaccine against HPV. And so that also has increased our knowledge of it, but it has also helped us decrease the rate of abnormal cells on the cervix because of the vaccine. When you have a pap smear test, there's two pieces to it. The first is that you have the pap test, where we just swab the cervix, and then we take those cells and we look underneath the microscope. We call that just a pap test or a pap smear test. The second piece of it is looking for HPV in the same swab. It's not like a separate swab, it's the same exact swab, and they're able to look at those cells and see if there's any HPV. So people can have a pap test and HPV testing. They can have either or they can have co-testing, which is the pap smear and HPV testing done together. And there's guidelines for that. We've gotten so good that we can now kind of hone in on who needs a pap smear, who doesn't, who needs HPV testing, and who doesn't. So I'm going to read the guidelines. This is ACOG, and I want to make sure that I say this properly. ACOG is the American College of OBGYNs, and almost all of us out there follow these guidelines. So they divide it by age. So between the ages of 21 to 29, a person needs a pap smear every 3 years. HPV testing can be done on women between the ages of 25 to 29, but we still prefer doing a pap smear on women between the ages of 21 to 29 every 3 years. If you are 30 to 65, you have three options. Option number one is to do a pap smear every 3 years. Option number two is to do a pap smear with an HPV test, co-testing, every 5 years. Option number three is just to do HPV testing alone every 5 years. So there's three options, and each of your doctors, you have your own conversations. Everybody's a little bit different, but during that age group, there's three options. Over the age of 65, you can stop getting cervical screening tests if you've always had normal pap smears. There are exceptions to the rule, obviously, because everybody's body is different. Your relationship with your doctor is different. There are some doctors who still follow some older guidelines, and it's just a conversation with your doctor to kind of decide what to do. So a few kind of hard and fast rules are these guidelines do not apply to you if you've had cervical cancer in the past. These guidelines do not apply to you if you have some type of immune disorder. Your immune system, if is not doing well, it can't fight off the HPV, and people with immune disorders tend to have more problems with precancerous and cancer cells on the cervix because the HPV, you just can't fight it off. A great example would be people with HIV. HIV affects the immune system, and therefore those people have a harder time fighting off the virus. People who've had a hysterectomy, which is removing the uterus and the cervix, those people may not need any screening. Sometimes your doctor will still do screening every 5 years. That all depends. So if you've had if you've had your cervix and uterus removed for non-cancerous reasons, then a lot of times we stop doing pap smears. So there you have it. Why don't I need a pap smear every single year? And it's just two reasons again. One is we have gotten so good at understanding how cervical cancer develops. We have also gotten so good at understanding HPV, and we have the vaccine too because we've gotten so good at it. My name is Dr. Syal, and I hope this helped you understand. Please join my community, Go Gyno, and the Red Tent community, because I want these conversations to continue and to talk about women's health and everything else in between, and destigmatize some of the things and some of the misinformation that is online. Thank you very much.